Hello friends, Om Namah Shivaya. Today I am here to give you some knowledge on the rainy season diseases which take place during the rainy season. There are different diseases ranging from fever to other problems like there is indigestion or sometimes vomiting or there may be lack of appetite, hepatitis, jaundice and different type of fevers. About jaundice and hepatitis B and the digestion power problems have already been discussed in my previous videos. And today I will tell you about the typhoid fever, which is waterborne disease which takes place in the body by drinking the contaminated water and taking contaminated food. The system of sewerage is not very good, so the drinking water is mixed with the rainy water or drainage water. And there is a bacterium Salmonella typhi which is available in the contaminated water, which enters in the body and gives you the enteric fever. And in enteric fever there are certain symptoms. By seeing that you can recognize it. First of all, there is a high grade fever, that is 102 to 104 degrees Celsius. Secondly, there are red color rashes on the upper abdomen of the body or upper abdomen and on the back of the body. There is a continuous pain in the stomach. The patient feels lack of appetite and the level of WBC increases in the body and creates anemic problem also. Sometimes there is a bleeding in the stool also. So if this disease is not treated properly, it can relapse after a few months or after few days. For treating this disease, first of all, we have to bring these red rashes which are available on the mucosa of the intestines out on the body so that the treatment can be proper. For bringing that rashes on the body completely, we give the decoction of Munecca, five pieces, Unap, 5 pieces, then neem leaves 10, and few grains of ajwain and 5 grams of khoob kala to be boiled in 400 grams of water. When 150 grams is left, it should be given to the patient by adding 1 spoon of honey in it. But this is the dose for the adult. If the child is below 8 years or of 8 years, the quantity of this decoction should be reduced. And in very small children, the decoction should be given in drops, 10 drops, 15 drops or 20 drops thrice a day. And similarly, for fighting this disease, when we have to give the patient only cooked food. Uncooked and raw food should not be given to the patient. because he is not in a position to eat due to the rashes in the mouth and throat. So the patient can be given the khichdi of green moong dal and the suji ras with milk or tea. Solid should not be given, and all the spices have to be avoided, and ghee is to be avoided, and we can put butter in khichdi, and green vegetables soup can be given. Juice of mosmi and anar is to be given to the patient in small quantity, in 4 or 5 times. Then there is a proper medicine which can be used, that is Sarv Jwar Har Lo, Anand Bhairav Ras, Kasturi Bhairav Ras, then Basant Malati Ras. These are all tablets, and mixed with Mukta Shukti Bhasam and Prabal Pishti Bhasam, Tankan Shar, Safatika Bhasam, and Shrink Bhasam. This Kasturi Bhairav is necessary to give because in enteric fever there is bradycardia. So for controlling that, Shrink Bhasam and this Kasturi Bhairav is very good for recovery. And we have to make the combination of all these tablets. If the patient feels acidity also, then we can add Sanjeevani Vati in it. The dose should be given morning and evening with Khamira Kajwan or Khamira Abrisham with 1 spoon of honey. Both the Khamiras are Unani preparations, but these are available on the Ayurvedic stores also. Besides this, we have to give the patient spota, means chiku, in large quantity. It is very good and for recovery because the sugar level of the patient fluctuates in this disease, so it can recover from that problem also. And if there are rashes on the body and there is jalan, or you can say the patient feels panic or patient is feeling irritation due to those rashes, and we can apply desi ghee mixed with geru on the with cotton on the whole body on the rashes. So it will give lot of improvement. In this disease there is an increase in spleen also. Due to the increase in spleen, this WBC increase and patient becomes anemic. For juice of anar and mosmi will do very good in this problem. Besides this, patient is cannot be given these hot things, very hot or very cold things. One should be given the normal things on normal temperature, and this Kasturi Bhairav is to be given when there is bradycardia, because in that case the pulse of the patient becomes very weak. This is the whole treatment I gave you. You have to avoid the solid food, uncooked food, raw foods, and lastly the water should be given in boiled water either it is RO water or this UV water. Even then that should be boiled and made cold, and then it should be given. And this is the whole treatment I told you. If you follow this, the patient of enteric fever becomes good in a shortest period. Otherwise it takes very long period and it relapses after few days or after few months. But with this kada or decoction, the fever comes out, and all the disease which is in the form of rashes comes on the body, and within a period that goes down with this treatment. Thank you very much. I hope all of you would be happy and healthy in your homes. Thank you.